If you ever wondered whether physical therapy could make pregnancy more comfortable or even painless, one South Florida woman says it absolutely can. Kathleen Vigo, the founder of Painless Pregnancy, is helping moms to be move through motherhood with less pain and more confidence. Here's a look at how her company is changing the prenatal care experience.
I was working at a busy clinic and I started to specialize in pregnant and postpartum women, and they loved the therapy. It was working really well, but there were a few challenges to making that setting productive. And so I started seeing patients at home on the evenings and weekends. Arm comes up and over. The business model of Painless Pregnancy was essential. It sort of created itself because women had a hard time getting to the clinic on time and consistently, and then insurance was a barrier. So we work with women irrespective of whatever insurance companies they work with. So when we first meet a new mom that we're working with, we do an assessment head to toe. We're very holistic, and then we work on them with our hands, as well as giving them strategies to do in between sessions to keep the momentum going. So for example, if they have low back pain, we will do manual techniques to move their pelvic bones or align their spine, and then we prescribe for them specific exercises, stretches, postures to maintain in between. And we'll bring this to the front, drop it off. There's diastasis, where the abs are split down the middle. We have strategies to minimize that process. And we work on the pelvic floor. So we educate about things they can do to keep their pants dry, to make sure that intercourse doesn't become painful, to make sure that organs are not falling down through that cavity, and they can empower themselves to have a painless pregnancy. Since we work with them head to toe, they really feel like they've had the best massage, an excellent workout from a personal trainer, alignment from an expert. Like, there's all these components that feel great in your body. We like to start working with women as soon as they find out they're pregnant or as soon as they find out about us. And we typically work with them, whether it's twice a week or once a month, throughout their pregnancy and into at least the first year postpartum.